Hi everyone. So thank you all for joining, and I hope you enjoyed the opening ceremony. We're moving on to the first sub theme at the moment, and as you may have known, it's about COVID-19, a very pressing issue at the moment, of course. So it's really great to see that so many people are working on it. The first person for this sub theme is Angela Kim. She's already here. She's the head of analytics at AI at Teachers Health and an active member of Women in AI. And today she will give a talk about ethical AI on COVID-19 tracker. And at 11, Damian Zwietering will join us, and he's an IBM specialist who dedicates his career to achieving real world results, innovating with information. And the title of his talk is Fitting the COVID Curves. But now I would like to give the stage to Angela first, and then we will see Damien at 11. So good luck, Angela.
Thank you so much, Demi. Really appreciate it. Hi, everyone. It's such a pleasure to you, and I'm very happy to present the work. I was very fortunate enough to work with the Malaysian Technical University and in collaboration with other global universities and also Montreal AI Ethics Institute to assess, what does ethical AI mean for the COVID tracker and what kind of issues have been surfaced through this exercise. So as you can see that, there are so many the things you've been hearing about the COVID tracker, right? So when you think about COVID tracker, relaxing ethical requirements in a crisis could have unintended harmful consequences that last well beyond the life of the pandemic. So it is not enough to highlight the importance of ethics in data and the algorithm and technological the tools when we deal with COVID tracker and in this pandemic. So it is not strange to the layman nowadays about people talk about the COVID-19 tracker and also the data and what that means to us, right? So the sudden introduction of complex and opaque AI, automating judgment, and once made by humans and sucking in personal information could undermine the health of disadvantaged groups as well as long-term public trust in technology. This phrase really highlights the importance of what's so important about AI and trust and also transparency and ethical application of AI in especially in for the COVID tracker. So data sets used to train and refine machine learning algorithms are inevitably skewed against groups that access health services less frequently. And minority, especially ethnic communities, are those of lower socioeconomic status. So we are talking about marginalized cohorts of demographic. Sometimes we often forget. So that really brings the issue of ethics by design. So even when you are building the COVID tracker app, you should really take serious consideration about, are we really considering all these, the ethical, the database and the non-biased database, and hence the algorithm we built on top of the data is non-biased, especially when it deals with health issues. It's really critical. It's almost like life, death or life, the matter. So COVID-19 has already had a disproportionate impact on vulnerable communities, and we know these systems can discriminate, and any algorithm bias in treating the disease could land a further brutal punch. In December, this use case was actually I heard from the U.S. The collaboration, the university and hospital. They mentioned about from Stanford Medical Center, the algorithm prioritized home workers for vaccination over those on the COVID wards. So algorithms are now used at a local, national, and global scale to define vaccine allocation in many cases. AI plays a central role in determining who is best placed to survive the pandemic. So this really highlights the AI for democratization issues, which we cannot, highlight enough. In a health crisis of this magnitude, the The stakes for fairness and equity are extremely high, and medical staff highlights the well-established discrimination creep found in AI that uses natural language processing, which is kind of machine learning, and it's in part of AI technology to pick up symptom profiles from medical records, reflecting and exacerbating biases against minorities already in the case notes. So some hospitals already use these technologies to really extract diagnostic information from a range of record. And some are now diseased to identify symptoms of COVID-19 infection and similarly track and trace apps, creating the potential for biased data sets. So the researchers and AI scientists really write that in UK, over 20% of those aged over 15 lack essential digital skills, and up to 10% of some population subgroups don't even own smartphones. So whether originating from medical records or everyone technologies, biased data sets applied in a one-size-fits-all manner to tackle COVID-19 could really prove harmful for those who are already disadvantaged. And it was raised by the research team. The researchers and AI scientists point to examples such as the fact that a lack of data on skin color makes it almost impossible for AI models to produce accurate large-scale computation of blood oxygen levels, or how an algorithm tool used by the US prison system to calibrate reoffending and proven to be racially biased has been repurposed to manage its COVID-19 infection risk. So you can see that there are a lot of issues really involved in ethical data and AI issues when we talk about COVID tracker, and if sometimes broadly. So the first is beneficence. So use of AI is intended to save lives, but that shouldn't be used as a blanket justification to set otherwise unwelcome precedents such as widespread use of social facial recognition softwares. And in India, biometric identity programs can be linked to vaccination distribution, which raises concerns for data privacy and security. And other vaccine allocation algorithms, including some used by COVAX sellers, are driven by privately owned AI. So proprietary algorithms make it really hard to look into black box model, and it was shown how they determine vaccine priorities. And the second is non-maleficence, or avoiding needless harm. So a system programmed solely to preserve life will not consider rates of long COVID, for example. Thirdly, human autonomy must be part of the calculation. The professionals need to trust technologies, and designers should consider how systems affect human behavior, from personal precautions to treatment decisions. So to ensure that can be really delivered, we need to really consider when you create the project team or the initiative team who's going to work on the particular project, you have to really make sure that the team is comprised of all diverse and multiple disciplinary on background, because if you have only one kind of thinking, it's hard to imagine the things beyond their capacity. So it's really important to create very diverse and very inclusive, not just the skin colors and not just the simple demographics. Broader than that, you have to think about their study background and also their religious background, and even the things we normally can find, but all different attribute background should be considered to create a really truly diverse and inclusive team to work on this kind of very important project. Also, privacy concerns with respect to data collection and data accuracy are a growing problem, and organizations need to pay special attention to this issue. Vast data collection may be necessary for curtailing the spread of disease. So companies around the world are proposing phone-based apps that track individuals' contact with those diagnosed with or recovering from the virus. So Google and Apple, for instance, are partnering on an opt-in app for individuals to self-disclose their COVID-19 diagnosis. One might make a compelling argument that this is justified until the pandemic ends. Yet, once the precedent for this type of surveillance is established, how do you remove that power from governments and companies and others? Are really sunset clauses going to be built into organizations' data collection and use plans? The secondary use of the vast troves of tracking data, so data becomes the new oil, will undoubtedly entice organizations to hold on to them, especially given the financial profits that could be made of the data. Take the case of the app from Google and Apple. What happens when members of the public demand to get their data back, or EU data protection and privacy rules require the disposal of the data when it is no longer needed? Cases of abuse from covert data collection and sharing are already well documented. Organizations involved in data collection and analysis and their oversight need to be addressed. These issues now versus later, when individuals will be less forgiving if their data is inappropriate for other uses or used in ethically dubious ways. So finally, data-driven AI must be underpinned by ideals of social justice. We need to involve diverse communities and consult a range of experts from engineers to frontline medical teams. We must be open about the values and trade-offs inherent in these systems. Thank you. So any questions? I'd like to take some questions if there are any questions coming up from audience. Or maybe can I actually I'd like to use a poll. So I'm throwing a poll question. All right. So I'd like to launch a poll. So I'm asking to the audience, if you don't mind, please can you kindly pick yes or no for the question. Have you ever used the COVID-19 tracker personally? I might give you 1 minute to answer. Yeah, less than 1 minute actually. So why don't you, I'll do 5, 4, 3, 2, 1. Okay, 5, 4, 3, 2, 1, 0. I'll end the poll. So the poll, the statistics tells me we have yes, I've used the COVID tracker personally, 36% versus 63% saying no. So this is again really demonstrates globally. I've really experienced a similar experience. So majority of people actually didn't opt in for using COVID tracker. There was a quite big issues in Australia because it was unsuccessful because not many people opted in for using tracker, even though government tried to really enforce using the tracker to manage COVID-19 spread. Whereas in neighboring countries like such as Taiwan, I heard it's the opposite. Almost more than 90% of the citizens opted in for COVID tracker. Thus, it was very successful. And I had an opportunity to have an interview with digital minister from Taiwan, and she mentioned that actually they were very successfully collected data from citizens and used really data-driven approach to manage COVID-19 spread. And it was very successful in the beginning, and they're very happy about the tracking. But again, that really brings back the issues about how about privacy, data governance, and whose data is it? So how do you know how the data is going to be purged after certain period of time? So what's the data life cycle? And all these very complicated issues to layman, like everyday citizens, this kind of topic is not very comfortable. And also the education is another very big area that you need to really provide, really have a forum and community and government, and everybody should be involved together to have a really meaningful conversation. So it's all it's not just one size fits all. It's all very complicated, the issues. And the thing is, through this COVID-19 pandemic, a lot of people's data literacy has improved, dramatically. And through the collaboration project that we worked with the Malaysian Technical University and also a few other universities globally, everyone admitted the public, the knowledge about the statistics and data science and technology has dramatically improved, which means we need to provide more ongoing education. And I believe this kind of event is very useful because this gives a really great opportunity to really invite public citizens and people who's not really specialized in technology and come and listen and discuss, really having a meaningful conversation about what data privacy means to community and citizens, and what needs to be done, and all the best practices. What's the best practice to follow? So that kind of discussion should be happening more often. And I'm really glad that this kind of great event is happening, and also given the opportunity to participate.
Yeah, well, thank you very much for your explanation as well. So there was one question which came up when you were talking. It's what could you discuss the relationship between adopted AI tools for disease and policy regulations of a respective region?
Or the of respected region.
Yes,
So what do you mean by respected region?
I think that person means like for a specific location, so a bounded
Mm-hmm.
location.
Okay, so policy making regulations, very, very interesting topic. Thanks for sharing the question, by the way, because it is one of the really appropriate questions to be discussed when you talk about ethical use of data and algorithm and AI, especially COVID-19. Because this pandemic is not like optional. It's not like you try hard and you can avoid the situation. It's almost like you are forced in the situation, and the policy making and the regulation that's really highlighted through this pandemic, depending on different the regions in the world. We have a very different level of maturity, because AI, you can talk about all different countries introduced the national AI strategy very different time. So some countries really leading in terms of really establishing AI strategy. Hence, you really create as well established policy making, regulation, and governance as well. Whereas some countries just started about developing AI national strategy. So as a result, haven't had the chance to establish the policy making regulation from government, the framework yet. So which means there's a huge gap. So again, there's really role for the countries who's leading this way, really already established a really mature policy making and regulation, should really share the best practice excuse me, from with other countries who's actually less developed in terms of maturity. So which means the globally, like how G7, all these leaders in the global leaders, they come together and discuss about the finance and about the future direction of how the globally you should collaborate. There should be really more encouraged forums, like the global leaders, like really top leaders should come together and share all the university researches about what's the advanced policy making and regulation, what's happening, the best practice globally, and try to share the learnings so that the countries who hasn't experienced doesn't have to go through starting from the scratch. Because when you start from scratch, you'll be always following the tail of it. You'll be never on par in terms of really delivering the best practice of regulation and governance. So I should say that, I've experienced with my own eyes, depending on countries, there's different levels. I must admit, EU is leading the way because AI for EU and EU region, there's a lot of developed policy makings and governance, and also AI is not just technology discipline. It is with law and also social science and also psychology, all different behavior science, all coming together that truly promote ethical AI. So my long answer to that really clever question is, you see all different practices, and the best way is true collaboration. And you should really share the best practice, whether among academians or among politics, politicians and politics leaders, and among even technology companies, because corporates can play a really big role, because most of the cases they do have a head office in certain region, but they do have a branches, and also different regions they have offices as well. So it's a great opportunity to actually ensure and share the best practice through the corporate branches. So there are many different ways. If there's will, there's a way. So that's how I'll answer this question.
Yeah, okay. Thank you. In the meantime, more questions came up. So yeah, I hope you can answer them as well as you did this one.
Yes, please.
The first one is from Klaus, and it's Dear Angela, thank you for your insightful presentation. How would you rate the success of the usage of the COVID tracker in general?
In general, well, thank you so much for sharing. Great question, Klaus. It's really great question. Thank you. To rate the success, I should say, well, it's a medium, average. I can't say that it was very hugely successful, and I can also say we failed it, because we have to remember this was the first really pandemic, and the COVID tracker was introduced, and we were able to use technology and AI to actually track the spread of disease. And I was very fortunate enough to work with a team who actually developed very first online COVID tracker from Malaysia, Kuala Lumpur. And the guys, the startup team, they actually created the first online version of tracker, and it wasn't app based one, but it was online. And there's really opportunity, you can see that. But the thing is, again, if there's not enough data, then there's not much insights you can actually obtain. So we can't really use the insights based on the tracker to actually implement and deliver the changes and to improve the situation. So again, I think that's highly linked to not many people are opting in to use of tracker, is firstly because it's new. People are not used to about this COVID tracker, right? And secondly, we haven't developed enough trust from the community and citizens that what this tracker will do, because we for sure we know that if we opt in and use collected data, but we are not too sure about how the data being collected will be used. So there's not much transparency and not much trust built among the citizens. So it is kind of long way to go in terms of journey, right? But we need to start somewhere. We need to educate, and you need to find a way how to really display and share transparent the view about data usage, and also the algorithm, how it's built, and really ensuring for the people who's really use the opting in for the tracker will be very, very comfortable, because firstly, they know how it works. Secondly, they can have a strong trust in terms how the data will be collected and how the data will be purged, and how the data won't be used more than what you really opted in. So all those the implementation and delivering the process is very transparent. Then I think it will be more successful because people are comfortable opting in. As a result, we can collect enough data to track and manage the pandemic situation.
Yeah, thank you. So I actually pretty related to this one. It's not really a question, but Geronimo was wondering why people would like answer no to using the tracker. And like as you said already, like there needs to be like education about the trackers. Of course, that's the problem because people might be not aware of like what will actually happen with their data. But do you know of any extra reasons why people wouldn't use this tracker? Because it's, of course, like in this situation, it's difficult to ask everyone. But do you have any examples for that?
Thank you, thank you for sharing the question. Yes, Demi, as you mentioned, it is related to the previous question, but at the same time, this is really great question because I can kind of lightly touch on about the new point about that, that I haven't mentioned before. So it is again, some people opt in. So it's very interesting because some people, when you're opting in, when you're really allowing to use some to be used for the tracker, sometimes people do that because either they are comfortable and they believe in good outcome by opting in, but sometimes people opt in because they are ignorant, right? So you don't have enough information, so you opt in. But at the same time, you don't have enough information, so you don't opt in, right? So if there's no, so either way, it's not really fair way because you don't know exactly what's happening, so you opt in, then that's not serving the purpose for the general citizen, right? And when you don't have enough information how the data will be used, again, it's not a appropriate way to use it because it's not really serving our citizens as well, right? So a lot of cases, people are scared, they are worried, and because they don't know what they don't know. Because if we don't know, how do we really scope how much we don't know, right? So it is really complicated. Again, it ties back to the point I mentioned about education. So I was really impressed when I was visiting Boston 2019 September. I had the opportunity to go to Harvard University Berkeley Klein Center, and there was this workshop, and I was very impressed because the workshop hosted by Harvard Law School was open to public. So every lunchtime, not every day, but a few times a week. So there's this forum, and there's some great speakers, and people come and share their knowledge, right? And it's open to public, open to everyone. So people who's really interested in it, it's like almost like old days, you learn your knowledge, accumulate your knowledge by reading books, right? But these days, I think you can really go and attend forums and this kind of great event. People come in because this is free and this is open to public. So if you have a will, you can go and find it. So it's more like promoting people. There's opportunity and really almost like encouraging people to be more thirst for about the knowledge and learning about new things and really highlighting this is really important. This matters to you because it's all about you. The data is all about you because a lot of people, especially youth, when they're using free app, they don't know what they are really opting in because people don't know, and especially young people don't know because they're not educated. They don't have enough knowledge, and teachers don't have enough knowledge, and parents don't have enough knowledge, right? So public, this kind of forum plays really hugely important role. And again, that's why I'm really congratulating FruitPunch AI team for hosting this kind of great event. Thank you.
Very much. Yeah. Very much thanks for giving this wonderful presentation. I really enjoyed it, and I thought it was very interesting. And I do think that education is the next step, and that's most important. So yeah, thank you for joining us today.